So in LASIK, the cornea is reshaped to correct nearsightedness, farsightedness, and astigmatism. And there's a flap of the cornea which is created with one laser, which is called a femtosecond laser. And once the flap is lifted, then the cornea is reshaped using an excimer laser. And then the flap is put back down. And the whole procedure takes about 10 minutes to do 2 eyes. People are uncomfortable and a little blurry for the rest of that day. Usually I describe that people are seeing, it's like seeing underwater for a while. And the eyes are usually, it feels like you went swimming in a pool with a lot of chlorine. So it's the best thing to do after the surgery is just to go home and rest and take a nap. And usually by later that day, by the evening, people's eyes are feeling much better and they're starting to see a little more clearly. And then 24 hours later, they're usually seeing quite well. And the eyes are comfortable at that point. And people are usually quite amazed by how well they're functioning without glasses, even one day later. A good candidate for blade-free LASIK would be someone with healthy eyes who has a glasses or contact lens prescription that has been stable for at least a year or two. And so, because we don't want to shoot at any moving target. So it would be someone who has a level of nearsightedness, farsightedness, or astigmatism which is within the range that we can treat easily. Who has a cornea that's the right shape to start with and that's thick enough to do the laser on. And these are all things that we evaluate during the preoperative consultation. We do a free consultation on everyone who's interested in the laser vision correction, and these are all things that we look at very carefully ahead of time. If we identify someone who's not a good candidate because their eyes aren't healthy, they're too young, their cornea is not the right shape, their prescription is too high, then we don't do the surgery.